Kalbitor is a prescription medicine approved by the FDA for treatment of acute attacks of hereditary angioedema or HAE in patients 12 years or older. Kalbitor does not cure HAE, but some patients treated with Kalbitor have experienced significant improvement in the symptoms associated with their attacks at 4 hours, with continuous improvement through 24 hours. Kalbitor, ecallantide for subcutaneous use, should only be given by a doctor or nurse with appropriate medical support to treat serious allergic reactions and your hereditary angioedema. You should read the medication guide before you start receiving Kalbitor and before each treatment. Serious allergic reactions may happen in some people who receive Kalbitor. These allergic reactions may be life-threatening and usually happen within 1 hour after receiving Kalbitor. Do not receive Kalbitor if you are allergic to Kalbitor. To find out more and to read about other potential side effects, please make sure to review the full prescribing information and medication guide available at Kalbitor.com. There may be new information. Kalbitor Home Infusion Services is just one of the several options for receiving Kalbitor and is not for everyone. Kalbitor Home Infusion Services is not for laryngeal attacks. The first step is to talk to your doctor to see if this option is right for you. Kalbitor Home Infusion Services is administered by a third-party infusion services provider. The symptoms and severity of acute attacks of HAE described in this video are unique to this patient and may not be typical. Talk to your doctor to see if Kalbitor is right for you. Results from use of Kalbitor vary.
My name is Danielle, and I have hereditary angioedema, and I was diagnosed in 2009. I had my first attack when I was 21. My face swelled and my tongue swelled, and the doctors thought that it was a food allergy, and that's what I thought I had for 15 years until I got pregnant with my daughter 6 years ago, and that's when I realized that something definitely was wrong and it wasn't a food allergy at all. 6 weeks after I had her, they took out my gallbladder. It took another 3 years after that for them to finally diagnose me with the hereditary angioedema. I was happy that I had a diagnosis because I had something to fight. But at the time, I was terrified, and I had to go pick up my daughter and pretend everything was okay. And I was thinking to myself, what do I have to do to make sure I'm there for her, for all of her firsts? Because I didn't want to miss anything.
I met Danielle through the Kalbitor Home Infusion Services program. I was given the assignment to be her nurse, to meet her in her home. In the home setting, you're one-on-one. You are there, you're focused on that patient. You can concentrate on exactly what the patient needs, and you can give your all. One of the criteria is when the patient calls us, we ask questions to determine where and how the attack is occurring. If it is in the larynx or the neck area, we tell them go directly to an emergency department for emergency medical evaluation and treatment. We arrive, they're in a compromised state, they're in pain, they're anxious, they're really uncomfortable, they need help, and we can come in and administer the subcutaneous 3 injections. And then quietly monitor them, watching for any subtle effects of adverse reaction. We see benefits for this medication.
After you receive Kalbitor, your doctor or nurse should watch you for any signs of serious allergic reaction. Symptoms of a serious allergic reaction to Kalbitor can be similar to the symptoms of a sudden attack of HAE. Common side effects of Kalbitor include headache, nausea, diarrhea, fever, injection site reactions such as redness, rash, swelling, itching, or bruising, and stuffy nose.
I found out about Kalbitor Home Infusion Services from my doctor, and he felt that it would be useful for me. 2 years ago when I was diagnosed, I had to rely on people, and I had to worry how I was going to get to the emergency room, who was going to watch my daughter. I don't have to worry about that now. I don't have to worry about waking up my husband in the middle of the night. I can pick up the phone and I can make the call. I can put on my comfy pajamas, turn the porch light on, and I can get comfortable. And I can just wait for them to arrive. And for me, that's freedom because I'm in control.
I think historically, HAE patients have tended to kind of not listen to their body when they begin to feel these symptoms come on. With this program, with the use of Kalbitor and the nurse coming to the home, the sooner the patient begins to recognize those symptoms, the sooner they call us. So when the nurse arrives, we're able to treat them. I think patients really appreciate that.
My theory is, why suffer when you don't have to? I can pick up the phone, make the call to Kalbitor Home Infusion Services. It's just not worth suffering. I have too much to do. What I really like about Kalbitor Home Infusion Services is having the confidence of Kalbitor in the comfort of my own home. If I'm having an attack, I feel so comfortable knowing that she's there. It's just a phone call away, day or night. It's just nice knowing that there's a person like that on my side. That means the world to me.
Kalbitor is not approved for self-administration and should only be administered by a doctor or nurse with appropriate medical support to manage serious allergic reactions and HAE. Symptoms of a serious allergic reaction to Kalbitor can be similar to the symptoms of hereditary angioedema, the condition you are being treated for. Your doctor or nurse should watch you for any signs of a serious allergic reaction after treatment with Kalbitor. Tell your doctor right away if you have any of these symptoms of a serious allergic reaction during or after treatment with Kalbitor. Please see full prescribing information, including boxed warning and medication guide. Talk with your doctor to see if Kalbitor is right for you. For more information about Kalbitor and the Kalbitor Home Infusion Services, call toll-free at 1-888-4-KALBITOR. That's 1-888-452-5248. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088.